Psychosocial concerns of the older adult. Stresses of caregiving. Older people receiving care may feel they are being a burden, be angry or frustrated about giving up their independence, or become demanding in an attempt to regain control. Caregivers often feel overloaded, finding themselves pulled in many directions. There simply may not be enough time to meet all demands. Caregivers are at risk for stress-related problems, including depression, anxiety, and increased vulnerability to physical health problems. The caregiver's coping style, how it affects caregiving, and the quality of care. The caregiver's coping style, how it affects caregiving, and the quality of caregiver support system are important to assess. Conflict is possible between family members who live near an older person and those who live at a distance because of different perspectives. It is often helpful to remind distant family members not to let apparent differences between what they see and what the local caregiver has said discredit the caregiver. Local caregivers often must compromise with the older person and accept imperfect solutions to problems. One group of caregivers are known as the sandwich generation. These are individuals who are faced with caring for their parents while also caring for their own children. There are an estimated 44 million caregivers to the elderly in the United States. The clear majority, 75%, are employed. This places stress on the sandwich person. The pull of the workplace, home, and elder can result in loss of time at work. Such situations are estimated to cost U.S. businesses $34 billion per year. The nursing assessment should include the needs of the caregiver. Review the demeanor and responses of the caregiver and the patient that may indicate fatigue in relation to the provision of care for the loved one. Referrals to social services and available community resources may be indicated. Respite care refers to the provision of care by non-family members with the goal of allowing the primary caregivers the opportunity for relief from the stressors and strains imposed by caring for an ill or debilitated family member. That's respite care. Loss, grief, and depression. Significant psychosocial changes experienced by older adults typically include personal, social, and economic losses resulting from role changes, retirement, and the loss of significant others, parents, siblings, children, spouses, and friends. Physical changes often result in loss of independence and space. For some older adults, losses may occur suddenly, concurrently, or within a short period, thus increasing their impact. The ability to cope with grief and the related losses depends on many factors. Successful coping strategies to deal with grief may include avoiding isolation and self-pity, helping others, joining groups, adopting a pet, setting goals, maintaining independence, and retaining a sense of humor. Short-term or long-term depression may result in response to the grief from real and perceived losses. Fatigue, sadness, insomnia, anorexia, helplessness, crying, agitation, and hypochondria are frequent symptoms of depression in older adults. These symptoms are misunderstood commonly as changes that normally occur with aging. Misunderstanding and misdiagnosis too often result in many older adults failing to receive the needed treatment for depression. Depression is more common in the older adult than any other age-related group. Older people who receive psychotherapy for depression show improvement. Patient problems and interventions for older adults with loss, grief, or depression include but are not limited to the following. Complex grief related to losses. You want to encourage verbalization of feelings regarding losses, acknowledge reality of grief, plan care to promote consistency and reduce stress, encourage participation in activities to provide a distraction, refer to spiritual counselors or other support, spend time with the isolated individual. Helplessness related to personal, social, and economic losses, to allow older person to make choices whenever possible, encourage person to do as much for itself as possible, adapt environment to support independence, explain reasons for change, and plan a care. End of life care. Nurses who work with older adults assist the entire healthcare team to meet the physical, spiritual, and psychosocial needs of dying patients or residents. Caring for the family is an important part of this care. Knowledge about a person's culture and religious beliefs help the team provide compassionate care. Nurses caring for patients at the end of life need to understand the 1991 Patient Self-Determination Act, PSDA, as it relates to advanced directives, living wills, durable powers of attorney, and do not resuscitate orders. The healthcare team works closely with the patient or resident and the family to ensure that the patient's wishes are respected. Aging body. Physiologic change affects a person's biologic, psychological, social, and environmental status. Physiologic changes in the aging process result in a decreased immune response, a decrease in compensatory reserve, and a loss of the body's ability to repair damaged tissue efficiently. Numerous physiologic changes occur in all body systems during the natural aging process. There is strong evidence that inactivity is the most important contributor to declining physical mobility and function. Positive lifestyle modifications, including physical activity and proper nutrition, help optimize physical abilities and promote healthier aging. The degree and rate at which changes occur vary among individuals, systems, and organs, as does a person's ability to compensate. In this chapter, common patient problems and nursing interventions related to each system are identified for selected age-related changes. Additional patient problem statements and nursing interventions may be appropriate to meet the individual needs of the older adult. See specific chapters for the discussion of nursing interventions that are appropriate regardless of age. Integumentary system. Age-related changes. Aging skin is dry and thin and loses tone and elasticity. The loss of fat under the skin makes wrinkles increasingly apparent. Age spots called lentigo are tan or brown macules brought on by sun exposure and are more common in middle-aged and older people. Hair grays and thin. Distribution patterns often change, resulting in baldness. Nails grow slowly and become thick and brittle, developing ridges and turn yellow. Touch sensation often changes as a result of thinning skin. Disease process and responses to medication therapy. Susceptibility to infection, ecchymosis, and tearing increases with age. Wounds tend to heal more slowly than those in a younger adult. Assessment. Observe the skin hydration status. Pay close attention for signs of excessive dryness. Observe for skin tears or lesions. Note presence, location, and amount of exudate. Examine for lesions that have changed size, color, or shape. Lesions that are irregularly shaped, raised, crusting, or pitting, or bleed easily should be examined by a dermatologist. Observe hair for excessive loss, dryness, or oiliness. Observe the nails for color, length, shape, symmetry, and cleanliness. Nursing interventions are indicated to manage cleanliness, excessive length, sharp edges, brittleness, increased thickening, and color changes. Common concerns in nursing interventions. Pruritus. Older people may report dryness and itching of the skin, which is called pruritus. This is more common in cold, dry weather because of reduced glandular secretion and moisture. Because soap tends to be drying, older adults should use soap sparingly and rinse the residue completely away. Antibacterial soap is very drying and usually is not a good option. Skilled nursing facilities may have schedules for showering and shampooing. On non-shower days, a partial bath is provided, which includes the washing of face, hands, axillary region, and perineal area. In general, less frequent bathing is recommended for sedentary older adults because of a decrease in body oils and perspiration. Water-based or light oil-based lotions rather than alcohol-based lotions are the best to use. Application of water-based lotions to dry areas, especially after bathing, usually increases most individuals' comfort and avoids the feeling of oil residue that some people find uncomfortable. Moles. Most moles are benign. However, sun-related skin changes, including precancerous actinic keratosis, basal cell or squamous cell carcinoma, and malignant melanoma, sometimes develop on sun-exposed areas. Ask a dermatologist to examine any suspicious-looking lesions. Nail abnormalities. Bilateral clubbing of the fingers indicates possible pulmonary or cardiac disease. Yellowed nails indicate possible fungal infections. Splintered nails indicate possible malnutrition, and pitting sometimes signals peripheral vascular disease, psoriasis, diabetes mellitus, or syphilis. Brittle nails are often associated with fluctuations in hormones that occur during menopause. Pressure injury. According to the National Pressure Ulcer Advisory Panel, more than 2.5 million U.S. residents develop pressure injury every year. Pressure injury is a significant risk for older adults and patients with chronic disease. Thin skin and lack of subcutaneous fat predispose older adults to pressure injury development when their fragile skin is compressed between bony prominences of the body and other objects. Damage to the skin at these pressure points is best prevented by repositioning the patient at least every 2 hours. Many pressure-reducing pads and aids are available, but only those that do not restrict circulation or create pressure on surrounding areas should be used. Fragile skin bruises and tears easily. Fragile skin bruises and tears easily. Measures should be instituted to prevent pressure, friction, shearing forces that can injure small blood vessels by sliding on a rough surface, and moisture, most commonly associated with incontinence. Friction occurs when fragile skin rubs against the bed sheets. In addition to the normal safety precautions taken to prevent injury to any patient, gently handling during turning and transfer is necessary. Additional assistance or equipment may be needed to lift and move a resident to avoid friction, burns, and tearing of the skin during repositioning in bed. The use of tape on the skin of older adults should be kept to a minimum because fragile skin can easily tear in the process of removing the tape. Urine, drainage, or fecal material left in contact with the skin, even for a short time, potentially causes the skin to become impaired. Urine and stool tend to accelerate the formation of pressure injury at pressure points such as the coccyx or hip. Urine drainage and fecal material must be removed and the skin washed, rinsed with clear water, and patted dry. Prevention and the healing of any pressure ulcer depend on good nutritional status and adequate hydration. A well-balanced diet with attention to protein, vitamins, and minerals play an important role in maintaining skin integrity in the older adult. Patient problems and interventions for a resident with pressure injury include, but are not limited to, the following. Potential for compromised skin integrity related to fragile skin associated with aging. The nursing interventions would be to perform daily skin inspection, reduce frequency of bathing, use mild, non-irritating soaps and rinse thoroughly. Use emollients and lotions to maintain skin moisture. Turn and reposition frequently. Move and transfer carefully. Reduce sources of pressure. Keep linens clean, dry, and free from foreign objects.